Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Swollen tongue causes and treatment. A swollen tongue can be caused by several things, from allergic reactions to an injury in your mouth. Some causes of a swollen tongue can be harder to spot, like a side effect of a medication or an undiagnosed health condition. /r/n/r/n Glossitis refers to a swollen tongue due to inflammation. Edema is another medical term for swelling, but it's due to fluid building up in the tissue. Swelling of the tongue can be an annoying, but harmless, problem. However, it can also be a sign of a serious, even life-threatening, condition. /r/n/r/n Some tongue diseases and conditions can be treated with medications, such as antibiotics for bacterial infections. Others may require simple at-home remedies, such as practicing good oral hygiene. /r/n/r/n Depending on what's causing the swelling, one or both sides of your tongue might get bigger. Your tongue may also itch or hurt. The swelling and other symptoms can make it hard to talk and eat. /r/n/r/n If your taste buds are affected by the swelling, you might have an unusual taste in your mouth. /r/n/r/n Some symptoms are serious, including /r/n/r/n Swollen tongue is always a reason to call your healthcare provider for an appointment. /r/n/r/n However, if you have a swollen tongue and trouble breathing, are drooling, or are unable to swallow, don't wait. Call 911 or go to the emergency room right away. /r/n/r/n There are many reasons that your tongue can swell, including health conditions and reactions to medications. Injuries and irritants can also lead to a swollen tongue. /r/n/r/n Food allergies and allergic reactions to chemicals are the most common causes of a swollen tongue. /r/n/r/n You might only have a mild allergic reaction that gets better on its own. However, swelling that's caused by anaphylaxis is serious, or you could even die from it. /r/n/r/n Some people are born with allergies or get them in childhood. When they develop later in life, they are called adultonset allergies. /r/n/r/n Symptoms of an allergic reaction usually start within minutes or hours of coming into contact with an allergen. Common food allergies include /r/n/r/n You may also have allergic reactions to non-food products. /r/n/r/n For example, dentists often see patients who have had reactions to flavorings, dyes, and chemical additives in toothpaste, mouthwash, denture cleansers, and other oral care products. /r/n/r/n Angioedema is a medical term for swelling under the skin. Usually, it refers to swelling caused by an allergy. /r/n/r/n After food allergies, medication reactions are the most common cause of angioedema of the face, lips, or tongue. /r/n/r/n The reaction happens when the body releases too much of an immune system chemical called bradykinin that opens blood vessels. /r/n/r/n Many prescription and over-the-counter, OTC, medications can cause non-allergic tongue swelling. Less often, a swollen tongue can be a side effect of a medication, including the following ones: /r/n/r/n Diseases of the skin can cause tongue irritation, which may lead to a little swelling. /r/n/r/n For example, mouth sores and tooth erosion can cause the tissue around the tongue to swell. /r/n/r/n Here are a few examples of skin diseases that might make your tongue swell. /r/n/r/n Burning your tongue on hot foods or drinks, biting your tongue, scraping your tongue on rough teeth, or piercing the tongue can cause temporary swelling. It should get better within about 5 days. If it doesn't, see your healthcare provider. /r/n/r/n Dentures and other types of dental implants can also cause injuries. This can happen if they don't fit well. /r/n/r/n Serious injuries and oral piercings can also lead to a bacterial infection called Ludwig's angina, which causes pain under the tongue and swelling. /r/n/r/n If the infection is not treated immediately, the swelling can cause your airway to become completely blocked. /r/n/r/n If you have symptoms of Ludwig's angina, you need treatment right away. Call 911 or go to the emergency room immediately. /r/n/r/n The mouth is susceptible to many types of infections, including tongue infections. Some, like sexually transmitted infections, STIs, are passed through oral sex. /r/n/r/n Syphilis, gonorrhea, and human papillomavirus, HPV, can cause inflammation, sores, warts, or swelling of the tongue and the tissue around it. /r/n/r/n Some people have reported COVID tongue, a discolored and swollen tongue caused by COVID-19. /r/n/r/n Gastroesophageal reflux disease, GERD, is a digestive disorder that causes acid from the stomach to back up into the esophagus. It can cause chronic irritation at the back of the throat. /r/n/r/n In some people with GERD, the base of the tongue is also affected and may swell. /r/n/r/n Tongue swelling called atrophic glossitis can be caused by several different vitamin and mineral deficiencies. /r/n/r/n Sjogren's syndrome is an autoimmune disease that causes dryness of the eyes and mouth. The condition can also cause swelling in the salivary glands, which make spit, and the lacrimal glands, which make tears. /r/n/r/n Some people with Sjogren's have a tongue that looks or feels swollen. /r/n/r/n Melkersson-Rosenthal syndrome is a rare disorder of the central nervous system. It mostly affects the facial nerve and the muscles of the face. /r/n/r/n The most common symptom is facial paralysis. Some people with the condition also have permanent swelling of their face, which can include the lips and tongue. /r/n/r/n Amyloidosis is a rare disease that happens when too much of the protein amyloid builds up in the body. The heart, brain, kidneys, spleen, and other organs can be affected. /r/n/r/n Aside from having a swollen tongue, you may also feel very weak or tired, bleed or bruise easily, and have shortness of breath. Swelling of the belly, legs, ankles, or feet can occur, and you may have tingling in your hands or feet. /r/n/r/n Males are affected at a much higher rate than females. Infections and other conditions that cause chronic inflammation can increase your risk of developing amyloidosis. /r/n/r/n Tongue cancer is a rare cause of a tongue. It can look or feel swollen, and the discomfort is related to a cancerous growth, tumor, on the tongue. /r/n/r/n Depending on where the tumor is located, you might also feel like you have a lump in your mouth or throat. Other symptoms of tongue cancer include a sore mouth, tongue, or throat. /r/n/r/n In some cases, the discomfort is bad enough that a person has trouble talking, chewing, and swallowing. /r/n/r/n Tongue swelling that's related to cancer does not go away on its own and may get worse over time. /r/n/r/n If your tongue swelling is getting worse or you have other serious symptoms, like trouble breathing, seek emergency care rather than wait to be seen by your healthcare provider. /r/n/r/n If your tongue is only a little swollen and you don't have other symptoms, you can call your provider and make an appointment. /r/n/r/n To figure out what's causing the swelling, your provider will look at your tongue and the tissue around it. They'll also make sure that your airway is not getting blocked. /r/n/r/n Here are some key points that your provider will assess during the exam. /r/n/r/n If your provider thinks you have an allergy, are having a drug reaction, or have an underlying medical problem that hasn't been diagnosed, you may need to undergo more tests. /r/n/r/n. For example, your provider might scrape a bit of tissue off your tongue and send it to a lab to be looked at under a microscope. If they think you might have an autoimmune disease, they may order blood tests. /r/n/r/n. In some cases, your provider might choose to start you on treatment before they figure out the exact cause of your swollen tongue. For example, they might be able to give you medicine to make sure the swelling does not get worse. /r/n/r/n. If your airway is blocked, the most important goal of treatment will be making sure that you can breathe. The next steps are to get the swelling down and ease any discomfort you have. /r/n/r/n. Once your immediate needs are met and you are safe, your provider will help you take steps to prevent a swollen tongue in the future. /r/n/r/n. Up to 15% of people with angioedema will have a blocked airway. They need to have an injection of epinephrine right away. /r/n/r/n. In less severe allergic reactions, an oral antihistamine can be given instead. Allegra, Zyrtec, and Claritin are all different OTC antihistamines. /r/n/r/n. If tongue swelling is not related to an allergy, your provider may use one of these treatments. /r/n/r/n. If you have a swollen tongue because you have an infection or a medical condition, your tongue won't get better until you treat the root cause. /r/n/r/n. For example, your provider might prescribe you antibiotics if you have an STI caused by bacteria, or immunosuppressants if you have an autoimmune disease. /r/n/r/n. To help with symptoms, your provider might also recommend products that relieve dry mouth. /r/n/r/n. For example, prescription medications like Allergen, pilocarpine, and Evozac, Savimilene, increase saliva production. There are also OTC rinses and sprays that work as artificial saliva to add moisture to your mouth. /r/n/r/n. If your tongue swelling isn't very bad and is not getting any worse, there are some things you can do at home to help with your symptoms until you can see your provider. /r/n/r/n. The causes of a swollen tongue can include allergies, infections, trauma, GERD, drug reactions, autoimmune diseases, or air disorders. While it's less common, tongue cancer can also cause a swollen tongue. /r/n/r/n. If you have a swollen tongue that isn't very bad, make an appointment to see your provider. If the swelling is getting worse and you have other symptoms, like not being able to breathe, seek emergency medical care. /r/n/r/n. The treatment for a swollen tongue depends on what's causing it. Good oral hygiene, antibiotics, antihistamines, corticosteroids, and products that help keep your mouth moist may help. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.